I see people using nose sprays incorrectly all the time, and with just a couple of corrective tips, we can get them to be quite effective. This one is an example of an over-the-counter nasal steroid that's used all the time to treat nasal allergies, snoring in kids, and a variety of other things. You have to shake these up when you use them. Most people think that you just put them in like this, squirt it, and inhale. It turns out that the air doesn't go this way. The air actually goes this way through the nose. So we use a technique called nose to toes, where you actually have to bend way over and put the nose spray in this way. You can see that nose spray is perpendicular to the face, but most of these over-the-counter bottles don't actually spray very well horizontally, so it needs to be vertical, but perpendicular to the face. So, nose to toes. You put it in as far as you can comfortably place it, and then squirt. When you're squirting it in, you want to aim right here towards the hairline. That's approximately where the air goes, or the direction that the air goes. When you're doing it from the front view, you don't want to continually spray the middle of the nose. That can be dangerous to the septum. So you want to spray it just a little bit off of the middle line, just a little bit laterally. For this reason, if you're doing it on yourself, it's a little bit better to use your right hand to do the left nostril and your left hand to do the right nostril. In kids, you can kind of manipulate the kid and position the child just how you want them. In kids, it's not that important if they don't inhale, just as long as they're not exhaling when you give them a puff. Usually with correct technique, in 2 or 3 days, you'll start seeing some effect of this if it's going to work. All right, nose to toes. Pro tip. If your child's having trouble cooperating with the nasal spray, 1/4 to 1/2 teaspoon of honey as a chaser after the spray can eradicate the aftertaste that many of these medicines give you. Thank you for watching, and check out more at InsideChild.org.